Hi everyone, my name is Manuela. I'm a rotational physiotherapist. What that means is that I rotate around the different departments in the hospital. Depending on which hospital you work at, the rotations might vary slightly. So the rotations I have done so far are acute assessment and frailty, which is where a patient would come in and you would find out all their social history, you would make an assessment and treatment and decide if they're back to their baseline and suitable to go home. I then rotated onto trauma and orthopedics, which includes traumas and elective surgery, like hip replacements and knee replacements. So on that rotation, the main things would be to get people back on their feet after they've had surgery, and going through different exercises with them and then making the appropriate referrals so they get followed up at home. I then moved on to the medical wards, which is sort of a follow-up from the acute unit, where people just need a bit more time to get a little bit better. I then did surgery, which is after surgery, people have like multiple attachments and they're in some pain or might have some respiratory issues. So it's just making sure that you're supporting them and getting them back onto their baseline. I then did respiratory, which involves working on critical care and on the wards, and you have to assess and treat patients with different respiratory conditions. I'm currently working on the stroke ward, so assessing and treating patients after a stroke. I'm on an acute unit, so it's just after the patient has had a stroke. Following that, I'll be moving on to pediatrics and then MSK outpatients. So physio is very broad, and you'll find out what you like by doing the rotations. Not everyone likes everything. I graduated in 2018, so I've worked in the NHS for 2 years. The qualifications I needed to get my job were, I needed a physiotherapy degree, and to get that I needed a biology A-level, along with 2 other A-levels, and I think the requirements for my university were ABB, and obviously GCSEs included maths, English and science. My favourite thing working in the NHS is that every day is different. I'm continuously learning and developing my skills, so it's never boring. What I find hard about my job is that sometimes you have to treat patients who are approaching their end of life, and sometimes that's quite emotional, especially when you're having to discuss that with their relatives. They're just difficult conversations to have. The thing that motivates me to go to work every day is that I know people need my help, and seeing the positive effect that my treatments has on these patients and their quality of life is really rewarding. The advice I give a young person who's interested in my career is research what physiotherapy is and the different like types of physio, because it's so broad and no one likes all of it. So even if you like a certain aspect, it's worth going for it, because even like you might have to do a few rotations to improve your skills, but you can always end up doing the bit that you're actually interested in. Working in MKUH is great. It's hard to describe it in one word, but everyone here is very friendly and it's a great place to work at. Thank you for listening. Bye.